racetrack and the clubhouse, and again, that's dealing with the slots funding. So it's a good time for you all as a community, as a neighborhood association, to put your input in regarding how that money is gonna be spent. Again, I know George Mitchell's gonna kind of talk on it, so I don't wanna just kind of give you a heads up as a reminder about the meeting. Again, it's September 24th, 6 o'clock at the Pimlico Racetrack in the clubhouse, where they'll be talking about the fiscal year 2017 for the slots funding. Let your voices be heard. I mean, I know you, like George Mitchell at the court, he said, you all know what you best need for your community. You all know what you want, you all know what you need. And yeah, it's not a lot of money per se, but if you share your voices, your thoughts, your concerns, at least you know what's going on, at least you know how it's being spent, at least you put your 2 cents in as to what you want to see in your community.
Okay. All right, thank you, Michael.
Thank you.
All right. We're gonna move on now to
Bridge Health, specifically Sinai Hospital for this neighborhood. And I think that some of you are already familiar with this because Izzy says that he's already given out surveys. But I wanted to come and explain the whole process to you and tell you what we're gonna be doing next month and get surveys from anybody who hasn't done them yet. Every 3 years, the federal government now requires all nonprofit hospitals every 3 years to do a community health needs assessment and to respond to what we learn in that assessment with some kind of programming that is in response to those top needs that the community has expressed and that we know from the public health data. You know, we look at all of that and we know what the rate of death from HIV in this community is, those kinds of things. But we want to, this is really to poll the community and to find out from all of you, what are your major concerns? Because sometimes we know that heart disease is the biggest killer in the country and of course in Baltimore and the state of Maryland, but maybe it doesn't affect you personally. Maybe you're more concerned about HIV or about, last time in our, this is the second one we've done. It was mandated 3 years ago for the first time. And last time, we found that people in this community, as well as the other one that we serve with Northwest Hospital, which is Randallstown, put heart disease, cancer, you know, the big killers there. But in this community, people said to us, well, there are too many young men under 18 dying in our streets. So that rose to the top for Park Heights along with heart disease. So we developed programs to look at both of those. So what I'd like to do tonight is take a few minutes for those of you who haven't filled out the surveys, and we'll do that, and then, you know, I'll make sure I have them before I go. And then the other thing I wanted to tell you about is what we do as the second stage. The survey, the paper surveys has gone out. Izzy told me tonight he thinks we're gonna make 1,000 for the 2 communities, which is great, because last time we only had about 700, I think. So we're getting out to a lot more people, and we will take these surveys and put them into the computer database and come up with what the top needs are from the people who filled out the paper surveys. But then we want to talk to people more than just look on, you know, because you just check things on a piece of paper. But part of the reason that we wouldn't have known to do violence, an anti-violence, a violence prevention program here in Park Heights if we hadn't talked to people. Because by the numbers, it wasn't the highest. There were lots of others that were higher. But from talking to people, we recognized that this was I mean, we're in this community, so it's a pressing problem for us. But we also recognized that that was from the voice of the people. Another thing that was voiced at the last one was people said we know we're not supposed to go to the emergency room for our primary care, but we don't have transportation to Pikesville or wherever to go to an urgent care center. So those of you who've driven by Sinai Hospital on the corner of Silver and Green Spring Avenue, there's a big sign that says coming soon, express care, urgent care center. So, you know, we listen to those things. It may take us 3 years to get around to doing it, but this is really important. And we wouldn't have, that wasn't on the paper either. So that's why we want to do these forums. So after we get all the surveys into the computer, we're going to come back at your October meeting and we're gonna talk about what the paper surveys have showed us and tell you what the top, the top the health needs are that the people who filled the surveys out have told us. But then we want to talk to you about it, and we'll have a kind of like a voting thing where we'll give you 3 votes. Everybody gets 3 votes, and you can put them all on one, or you can put them, you know, in 3 different. And we want to talk about some of the other questions here, like where you go for care and those kinds of things, because those go into helping us decide what to do. And so you will help us to prioritize, and then we also listen to your ideas for the kinds of programming you'd like to see. So that's what we're gonna do in October. And so this is I think this is beautiful. I love all these people holding up the community banner. We're having 3 forums so that we can hit different places and different times. But the one for Neighborhoods United is our first one. That's Tuesday, October 20th, here in, I guess, downstairs, hopefully, if we get downstairs next month. And we will do that exercise with you and talk to you about, you know, what's really behind what you filled out on papers. So, are there any questions? Is it?
Not a question, just a comment. Dr. Young, I just want to publicly thank Neighborhoods United for the work that they've done in getting these surveys. The reason we're about to cross 1,000 completed, submitted surveys is largely due to the partnership with Neighborhoods United. Don't want to use a football metaphor, but I know George is a former football player, so I will use one. And Neighborhoods United has an awesome ground game. And so the ground game was in play on this community health needs assessment. So all the community leaders that participated, thank you, thank you, thank you.
Yes, we will thank you, and I thank Izzy for doing this. So Oscar gave me the first one. If those of you who haven't filled them out can take just a few minutes to do it, and then I will get out of your hair. But we really
But you need to
appreciate
live in this area, community to fill it out, right?
Well, we prefer that,
Oh,
yes,
okay.
but we've had people who were, I don't know, up at VHAP, they had a bunch of people from East Baltimore, and they filled them out, and, you know, we'll look at them, but it's the zip codes, you know, that we serve the most are the ones that, but we want everybody's opinion. All the hospitals are doing it, so the hospital in your community, if you don't live here, is probably doing it. Yeah, they all do them different ways, so it may be that they're not doing surveys like this. Does anybody need a pen?
So what were you mentioned 3 years ago when you did the survey, there was crime, violence, death was the issue of young people. So what was it that LifeBridge did after that to help support or prevent?
Yeah, what we did was we developed a program. It's a small program. It's really, you know, almost pilot size. We were able to get some of that SLOTS funding that they were talking about and use it for that, because that was the priority the last time, to, you know, youth violence. And we focused on and we're gonna have, that's the other thing, I'm gonna bring the people who did the heart program and the violence program next time to give you a brief report back on what we did. But anyway, we focused on the 18 to 25-year-old group, and we, some of those people come from being victims of violence themselves to our ER. We had somebody, you know, the ER referring to our male outreach worker. Others came from Safe Streets, or, you know, they weren't in their district, or just word of mouth or whatever, but we got referrals. And if the person needed a GED, we had GED teaching. If they had finished high school but didn't have a job, we have, at Sinai, they have something called VSP, which is our vocational services program, and they put them through this pre-employment and then an actual, like an internship at Sinai. And I don't have the numbers, as I said, it was a small program, but we had several people graduating from that, and then they helped them, you know, to find jobs. Those were the 2 main interventions, and then a lot of work with a mentoring kind of model. We hope that will continue into the next year, even if violence doesn't rise to the top. It's a good program, and we think, I mean, by numbers, you know, we think that we will continue that. And then the other one we did was a heart disease. We had a screening program, and we follow-up by 2 nurses and a community health worker.
Thank you.
Thank you.
Thank you, Ms. Shaw.